Doctor, did this patient suffer from anemia? Yes. And this anemia is consisting of what? It may be primary or secondary, i.e., may be due to a primary abnormality of the blood or to a diminution in the concentration of the albumins or albuminous fluid of the blood, and in the number of blood cells secondary to some other disease. Doctor, what are the causes of secondary anemia? They are hemorrhage, blood poisoning, or septicemia, chronic poisoning from lead, mercury, and arsenic, chronic nephritis. Doctor, and the symptoms? The symptoms are general debility, indigestion, breathlessness, palpitation, and fainting attacks. The sequelae, doctor? The sequelae are persistent ill health and general debility. What is the duration, doctor? Indefinite. Doctor, aneurysm is a local dilatation, is it? Yes, a local dilatation and enlargement of an artery. What are the causes of aneurysm? Weakness of the artery owing to disease, commonly syphilis. Doctor, the symptoms depend entirely on what? They depend on the position of the aneurysm. The commonest site is in the aorta, and the symptoms due to this are pain in chest, dyspnea, cough, possibly blood-stained expectoration. And the complications, doctor, are what? They are pressure on the lungs, which may give rise to bronchitis and consolidation of the lung. Pressure on bones may give rise to erosion of the bone. Hemoptysis may occur in small or large quantities. Death may be caused by rupture of the aneurysm. Doctor, what is the duration of that or the complication? Indefinite. And angina pectoris? Angina pectoris is an element of the heart characterized by attacks of violent spasmodic pain in the cardiac region. What is the cause, doctor? The cause is unknown. Frequently, it is associated with high blood pressure. And the symptoms? Agonizing pain in the region of the heart, radiating to the neck and down the arm, pallor of the face, feeling of impending death. And the sequelae? Nil. What is the duration, doctor? Each paroxysm lasts a few minutes. The patient may then feel well within an hour or two or a day or two. The first or any subsequent attack may prove fatal, and the patient may live for several years with intermittent attacks. Doctor, let us go into the intricacies of arteriosclerosis. Well, the thickening of the arteries with loss of elasticity is called arteriosclerosis. What are the symptoms, doctor? These vary with the region of the body chiefly affected and are, as a rule, either cardiac or cerebral. There is commonly old age, excessive muscular work, syphilis, chronic poisoning, as a rule, either cardiac or cerebral. The common cardiac symptomatology is dyspnea, anginal attacks, pallor, cerebral symptoms, which may be passing, paralysis, vertigo, giddiness, general symptoms. And those symptoms are from old age? Old age. What are the complications? The cerebral hemorrhage, apoplexy, hypertrophy and dilatation of the heart, and finally aneurysm. Doctor, what is the duration? The condition is permanent and cannot be cured, though it may be temporarily relieved. Doctor, what about chlorosis? Chlorosis is a form of primary anemia characterized by a yellow-green tinge of the skin. And congenital heart disease, doctor? It is caused by an abnormality in the development of the heart in which the two halves of the heart are not completely separated. What is the symptom, doctor? It is dyspnea, blueness, palpitation. It occurs only in children who rarely survive after the age of puberty. The